Okay, good afternoon, everyone. I am Kunal Singla, work as Communication Officer at CHIP Foundation. I am truly delighted to welcome you all today to this inaugural panel's discussion of the online certificate course Understanding E-Cigarettes, Health Regulation and Impact, which is organized by CHIP Foundation in association with Eco India. It's wonderful to see so many passionate individuals coming together to discuss and understand the pressing issue of e cigarettes and their impact on public health, particularly in India. As many of you are aware, e cigarettes were banned in India in the year 2019, following growing concerns about their potential risks. However, despite the ban, the use and marketing of e cigarettes continue to remain a significant legal as well as public challenge. E cigarettes are falsely portrayed as a safer alternative to traditional smoking, and despite being prohibited, they still manage to find their way into the hands of youth who are often unaware of the dangers involved. In this online course, we aim to shed light on these complex issues. Together, we'll explore the legal and regulatory journey of the ban in India, discuss the potential adverse health effects of e cigarette use, and examine how public health initiatives can address this growing concern. By the end of this course, you will have a deeper understanding of the regulatory environment surrounding e cigarettes in India, the risks they pose to health, and the critical role that each of us can play in promoting awareness and advocating for stronger enforcement of the ban. Thank you for being here today. I hope you find the course insightful and that together we can take steps towards ensuring the safety and well being of our communities. Let's begin this important journey, and I look forward to an engaging and productive session with all of you today. Before starting the panel discussion, we would like to commemorate the upcoming World Cancer Day on 4th Feb by releasing the first newsletter of the year in presence of Dr. PC Gupta sir, Dr. Sonu Goel sir, and Dr. Ravi Mehrotra sir, along with ECHO team and CHIP team and all the participants. Understand everyone. Yes. Now I would request Dr. Mehrotra sir to say a few words.
Yeah, thank you so much, Kunal, for introducing the not only the World Cancer Day as well as uh, releasing the newsletter, which we try to put out every 3 months or so. So, at the outset, let me welcome all of you, especially on the occasion of the World Cancer Day. It is my honor and privilege to be here on this particular day. It is officially the 4th of February, but because there are so many other activities going on that day, we decided to treat this as a curtain raiser. This is a day which is dedicated to raising awareness, sharing knowledge, and driving collective action to reduce the global burden of cancer, which, as you know, is one of the second largest cause, and maybe it might be the largest cause of deaths all over the world and in the years to come, not only in the West, but also in South Asia, where we live in. This year, we are united under the powerful theme of united by unique. That is, each one is unique, but we are united. And this is the beginning of a transformative 3-year campaign focusing on people-centered approach for cancer care. What we're trying to say is that each person is different, and the path to diagnosis, treatment, and survival differs from each person. So, just like you have personalized cancer care, personalized treatment, similarly, I think all of us, we should know that each cancer journey is unique. Each person is an individual in his or her own right. And that is why awareness, as well as being careful to prevent cancer, is also an individualized thing. At the CHIP Foundation, we have always believed the key to tackling cancer lies in education, prevention, and of course, early detection. We have made significant strides over the years in these three crucial aspects, and I'm proud to share some of our accomplishments. Our capacity building programs, along with our partners like ECHO India and many other similar minded not for profit organizations, as well as the government, have helped empower healthcare providers, doctors, students, frontline health workers, and individuals with the knowledge and tools needed to recognize the signs and symptoms of cancer. Early detection has been shown to significantly improve the chances of successful treatment, and we work tirelessly to make sure no one misses the opportunity. Today, as I release the newsletter, which is a new platform to keep all of you updated, and many of you are regular listeners and regular attendees of our various programs. And I see today we have practically 50, maybe plus people, and I'm sure many more may be joining as the time goes on. We are, first of all, thankful to all of you, each one of you, for being with us in our journey. And also, we would like you to be a fellow advocate for the policies that support cancer prevention and treatment, raising awareness, and building capacities at every level. It is our belief that until our healthcare providers, scientists, researchers, doctors themselves are not aware, it is impossible for the same thing to happen, to be transformed, to be transferred to the public. So, in closing, I want to thank each one of you for the dedication and unwavering support, especially Professor Sonu Goel, and of course our mentor, Dr. Prakash C. Gupta, along with many others. I also see Dr. Rakesh and many other colleagues in the audience. Thank you so much for being there. We welcome you, and we would like to also share that, in making a difference and being together, we will continue to fight for the future where cancer is not a barrier, but a challenge we can overcome. As we talk about cancer Mukt Bharat, I mean, the more real thing is cancer Kam Bharat. That is, the number of cases should go down. And those who are diagnosed should be not only diagnosed early and also treated so that we can make cancer a chronic disease. So keeping in view The overall theme for the World Cancer Day is United by Unique. Let us all plan to unite, let's understand, let us continue to make this journey for every cancer patient a little easier and also kindle hope in those who are fighting the dreadful disease, in the fact that we will make sure that they do not suffer. They also will hopefully find their cancer journey a little easier. As mentioned by Kunal, we are starting a course. We just received confirmation from our ECHO colleagues for the entire country on cancer survivorship. We are hoping to start this as early as next week. And we hope to be covering all the 26 states and union territories in spreading awareness about what it means to go through the journey post-cancer or while the patient is receiving treatment, and how to make their life less complicated, less stressful, and hopefully pain-free. So thank you so much, all of you, for being here. And it's again my pleasure to welcome you to this particular program, which I know many people have been talking about, and they're looking forward to this, how we will want to celebrate or commemorate the World Cancer Day. Unfortunately, although we have banned way back in 2019, nearly 5 years ago, but e-cigarettes are still available in the country, although surreptitiously. So I think this is a very good, the novel nicotine delivery system. This is a good topic to start from. So I hope and wish you, all the participants and my fellow faculty, all the very best. Thank you.
Thank you, sir. Thank you, sir, for your kind words. And to all the participants, this newsletter will be also released on our social media platforms and on our website too. Now, I would like request Ms. Sanchika Chandra to initiate the panel discussion.
Thank you, Kunal, for hosting the inaugural session. Um, Hello, everyone. It's a pleasure to be here with all of you today as we embark a critical discussion surrounding the use of e-cigarette in India. Today's discussion is titled E-cigarette in India, Regulation, Health and Society. And I'm excited to have such an esteemed panel of experts here with us to explore this issue from multiple perspectives. I'm honored to be a moderating this panel today and introducing such a distinguished group of experts who will shed light on these issues. I would like to introduce Dr. P.C. Gupta. Dr. Gupta is the founder of director of Healis Sekhsaria Institute of Public Health. He has been a pioneer in fight against tobacco use in India and is a leading voice in promoting evidence-based policies to curb smoking and tobacco-related diseases. His expertise on regulatory frameworks and the public health implications of tobacco and e-cigarette has shaped policies in the interest of people's well-being. Now, our next panelist is Dr. Ravi Mehrotra. Dr. Mehrotra is the founder of CHIP Foundation and has been at the forefront of public health advocacy, particularly in the area of cancer prevention and tobacco control. He has worked tirelessly to build capacity, raise awareness, and create a robust framework for cancer prevention. His vast experience in public health initiatives will offer us a unique perspective on how to address the growing challenge of e-cigarette, especially in Indian context. And the third panelist we have with us, Dr. Sonu Goel. Dr. Goel is a distinguished public health expert and professor at PGI Chandigarh. Dr. Goel has a wealth of knowledge in epidemiology and public health policy and has conducted extensive research on tobacco use, its impact, and the regulation of tobacco products. I'm sure today's discussion will lead both the sides of insightful and a thought-provoking discussion. We will cover key topics including the regulatory landscape of e-cigarette in India, the health risk associated with its use, and how society will respond to this challenge. With this, I would like to ask my first question from PC Gupta, sir. So my first question is to you, sir. As someone who has been at the forefront of tobacco control, could you speak to us about the health impact of e-cigarette? How do e-cigarette contribute to the respiratory and other chronic disease? Over to you, sir. Please enlighten us.
Okay, even before health impact, I would like to start before that. The term itself, e-cigarette, because the term is a total misnomer. E-cigarette has absolutely nothing to do with cigarette, and industry has chosen this term only to benefit from the familiarity of everyone with the word cigarette and what it is. Otherwise, e-cigarette is simply a nicotine delivery device, which can be in any shape, and it's already available in the market, and you can see photographs everywhere of its shape being a hookah water pipe, or a pipe, normal pipe, or a cigar, or a cheroot. So it can be in any shape, nothing to do with cigarette, just to create that impression and confusion. They have kept the design similar to a cigarette. And to confuse further, they have put an LED light at the tip so that when sucks it, the LED lights up and looks like it is cigarette end that is getting lit up. So it is a total misnomer, total deception, calling it as e-cigarette. Now, the question about, and this deception, they have used it very well for marketing. It's a wonderful, it's a great marketing tactic that they have adopted. And although the impression that is created that it is a safe alternative to cigarette and it's beneficial and all that, it is meant for smokers. In reality, when you see the data, the awareness and marketing is much more towards adolescents, children and adolescents. And even with Indian data, we have proved, the GETS data, and I have also written papers on that, that the awareness of e-cigarette is far more, and even usage and experimentation among children and adolescents than among adults who are smokers. So this is purely an industry ploy to popularize e-cigarette. About health effects, the most important point we should remember is that it is not harmless. It still has a nicotine. There are many compounds, biochemicals compounds that get released and they get absorbed. We are learning more and more about the health effects. But the point that I would like to make is that never compare any health effect of anything to commercial cigarettes, because commercial cigarettes are known, understood as the most dangerous, the most harmful product for a human being, commercial product for a human being. So anything else in the world you compare with cigarette, it will be less harmful or beneficial compared to that. So one should never compare anything to normal cigarette. Compare everything, a new product, to something that we are already using in our home, in our kitchen, in our media. So if it is equal to harm in that, then it is acceptable, but not with cigarette. And so that is what I would like to say is introductory kind of a sentence or a para on e-cigarette. And I think you can go ahead with the further panel discussion, further questions on panel discussion to other panelists.
Thank you, sir. Your point well covered that, sir. It's a myth that e-cigarette is harmless. It is definitely a harmful product released by tobacco industry. So my next question is from Mehrotra, sir. Sir, could you please give us an overview of the journey of e-cigarette in India? How did they gain popularity despite the rising evidence of their harms? And what were the factors that led to the government's decision to ban them in 2019 completely? Over to you,
Yeah,
sir.
thank you, Anshika. And thank you, Dr. Gupta, for giving that background that are e-cigarettes. What is the confusion that has been created by the industry? As you rightly said, quite often they resemble a USB drive. Sometimes they resemble a pen. Sometimes they resemble a hookah. They could be in any shape, color, size, and so on. So, and as part of the newer electronic or novel nicotine delivery systems, it is a very good ploy. And these companies obviously enjoy the best of advertisement capacity. They have the necessary muscle power, money power, as well as the strategies that have been used to sell cigarettes for many, many years. So many of them are actually subsidiaries or have been bought out by the traditional cigarette company, whether it is US based or UK based or whatever. Some, of course, are standalone, but the most popular one that was Juul, were actually, I think they had a 40% stake, was bought out by Philip Morris. We all know that. As far as India is concerned, to answer your question, Anshika, they have been around for quite some time, at least the last about 8 to 10 years. And they were surreptitiously being stocked by various cigarette sellers, pan sellers, and also they were available online. And this was the time, I think, 2018 to 2020, when Juul was at its peak, especially in the West or the US. Mainly, I think not every, but a good number of high school students, especially, were taking this, and it was the rage. I mean, it was the current popular fad to not that we will not smoke cigarettes, but we will have much safer, so-called much safer device called ends, which, as Dr. Gupta has mentioned, would look fancy, looked swish, and had even vapors coming out. There were nicotine vapors, and they obviously did not know that in it how the vapor is formed, what all chemicals were there, whether it is polyethylene glycol or it is some kind of a chemical which burns and looks as if when the person is puffing, that smoke is coming out. It was obviously not smoke, but it was a very good marketing ploy, no doubt about it. And it was being seen in the Western movies, and it was being sold, especially in the upper class schools. It was prevalent. I remember here in Delhi, in Mayur Vihar, which is one of the more, not very far from where I stay, a school bag was confiscated by the teacher, and they found that 3 boys had got together and pooled their money to buy e-cigarettes, which they would have in their lunch break, going behind the bathroom. So obviously they did not have a lot of money, but to make sure that they had access to this particular new fad and they could show off to their friends. And peer pressure is very, very important. Similarly, we had reports coming out of various parts of the country that how these devices were being sold, not only offline but also online. And the ploy that was being given was that this is a safer alternative to cigarettes. And the government of India, way back, I think it was 18, constituted a committee at the Indian Council of Medical Research, where I was employed in those days. It was headed by the chairperson of the Public Health Foundation. We had Professor Gupta and many other experts who opined on this, and a report was produced, and that report was finally published in the Indian Journal of Medical Research as a fast-track publication. And on the basis of that report, as well as a consultation that was held at the Ministry of Health, the Finance Minister, Mrs. Sitaraman, announced in 2019 that all these newer forms of nicotine delivery systems, including e-cigarettes, are not going to be available, and their import was being banned. You could carry, I think, for personal use, but for commercial use, it was not possible. And that is when there was a lot of hue and cry from the tobacco industry or their surrogates that you are trying to bring down our freedom of consuming what we want. There were various news articles, including some which also quoted medical professionals, that how e-cigarette was the next best thing to 100% ban on cigarettes, and how we could be saving millions and millions of lives if we were not to ban e-cigarettes and make them available. But that obviously we knew that the funding is coming from the e-cigarette industry. Right here at the convention center in Greater Noida, a big conference was planned of all the e-cigarette manufacturers in the country. And unfortunately for them, the news reached the ministry, and the ministry had actually decided to not give them the permission to hold that conference at the very last moment. I remember very well. So a lot of effort has gone into, a lot of pressure was felt by many activists and many government as well as non-governmental organizations and experts in this area, that this ban should not be there, because India being a very large country and as an emerging economy, a lot of people have money to spare. And they felt that if India bans it, it already had been banned in a few countries, and India being such a large country, a potential market was lost to them. And at the same time, seeing in the India ban, many other countries decided to follow suit, and they also banned. In the meantime, there were court cases in the US, which I think we'll talk about later, and the major electronic cigarette industry in the US also suffered quite a blow. And their prevalence has actually gone down tremendously over the last few years. So we are just following and we were actually one of the torch bearers and the flag bearers of the ban that was existing in a few countries, but India was easily the largest country and largest population to follow suit. We can talk about how the ban is actually implemented and what are the problems, maybe as we go along in this particular session. But I thank you for asking. That's a very relevant question, because one has to know the history of where we are and where we started from before we go any further. Thank you.
Thank you so much, sir, for giving an overview on the journey of e-cigarette, how we got it banned in India. I would also like to inform our participants that our experts are, along with other experts, strongly stood up and took this action against the e-cigarette in our country. So I think we are like very much grateful that we are actually seeing all of you, or few of you who are behind this e-cigarette ban in India. My next question is from Sonu Goel, sir. In India, e-cigarette were first banned in Punjab. It marked a significant step in regulating such products. Sir, what happened during that period, and how the initial regional ban eventually led the nationwide ban in 2019?
Thank you very much, Anshika, and I think congratulate CHIP Foundation for organizing such a wonderful webinar. I think much needed webinar, much sort of information need to be given, and it was a good start by Dr. Gupta on the harmful effects and how the confusion has been created, and then Professor Mehrotra on what is the journey of e-cigarettes ban in India. So I think that gives an overall overview. So I'll be just giving an overview. Dr. Rakesh Gupta from SIPHER, I think he's sitting here, so I think he can amend me if I'm not wrong somewhere, because he was one of the person who was instrumental in getting e-cigarette ban in Punjab. So when I used to hear the stories from him in different meetings or informal discussions. So I used to hear how he convinced the secretary of Punjab to ban this e-cigarette. So it was way back in 2013 when he did so. But before that, he had an orientation on, I think, e-cigarette in US. So there he came to know that there is something, these e-cigarettes are very bad, and not many people were knowing at that point of time. So during that orientation, which he had in UCSF in US, so then he came along with some documents, some arguments, some review literature, and came to the Secretary Punjab, and then she was convinced. Madam Vinnie Mahajan was there at that point of time. She was convinced with the facts that yes, I think that's a good time to stop this sale, and we should nip the e-cigarette in the bud, because at that point of time, not many people were actually roaming around in India to propagate e-cigarette. Although there were a few, because Dr. Gupta told that there were few who approached him after that discussion. So I think, like all other measures, which normally take place at the subnational level and then goes to the national level, because in our country it's a federal structure, and in federal structure, more of the decisions are normally taken at the state level, and thereafter it goes at the national level. So similar thing happened, started in Punjab, and thereafter they were every state started doing, and it was, I must comment here, the efforts of all the non-governmental organization NGOs who are working in different states along with the government partners who led this initiative in their states and take that circular of Punjab, take the justification, and then most of the states have actually, I think, around 23, 24 states have actually banned the e-cigarettes in their state. And then I think what Professor Mehrotra has said about that IGMR paper, that was a, I think, seminal paper which has come from across the, I think, people who are experts across the country. So they came up with that policy paper, and that was published. And then there was a consultation with Ministry of Health and Family Welfare. And even during that particular time, lot much efforts were being made by, again, various organizations, pushing people, pushing various governments to ban this. So I think it was a decision which started at the subnational level, and which went to the national level. And the audience who are here listening to this webinar, I think this is the power which you can also start. We always say, why not start at the national level? But why you are there at the state level, if you can convince the state secretary, I think your NGOs, the academia partner, and the implementation partner all work together and convince your secretary health for a particular issue, it can go a long way. So I think this was just a conclusion of like what intricacies actually happened at the subnational level, which led to the national level. Over to you, Anshika, I think.
Thank you, sir. The fire started from Punjab. Many of us are not aware about this. Thank you, sir. My next question is from PC Gupta, sir. While the government has banned e-cigarette, evidence suggests that they are still being marketed and used illegally. In your expert opinion, sir, what strategies can be employed to ensure compliances with the ban at a grassroots level?
Yeah, very good question, but this is really a seminal question, which applies not just to e-cigarette ban, it applies to most provisions of CODPA and many other laws, that they are there, but they are getting flouted. And this e-cigarette is a very specific example, and with a specific genesis and possible remedies. We all know that this is being pushed by a very powerful, very rich industry. so they can sort of afford to get the material, this e-cigarettes in India clandestinely. And then partly, of course, because of a lack of awareness and knowledge, partly, of course, because of the lucrative nature of the business. There are many, especially these small kiosk owners and vendors who are willing to stop e-cigarette clandestinely, and they only take care that they give it to known persons or after inquiring that the person is not from any enforcing agencies. And most of the surprising, I mean, the really worrying part, bothersome part is that most of these vendors, they are the ones who are located near schools, colleges, and the places where adolescents frequent, because that is their real target population and market. So, the important part is enforcement, but in addition to enforcement, the awareness of knowledge, especially among vendors, people who are prepared and who are already selling or helping in distribution of e-cigarette. Also, one has to remember the confusion that is still being created on e-cigarette, their legality, illegality. Although now it is quite some time, 5 years or so, that e-cigarettes are completely banned in India by law. We still get people from all over the world, so-called experts, who come and lecture us and write articles in newspapers, in media, try to meet policymakers and other influencers to convey that this ban should be modified, should be lifted, and e-cigarettes should be, as Dr. Ravi also said, they will save lives if they are permitted. So, and we all know that this promotion and this advocacy and lobbying is being promoted by whom? Since they are not, it is difficult for the industry to promote it directly. So what they did, they created a foundation for a smoke-free world. And not with a small amount. Philip Morris did that, and with $1 billion. And after a few years, when it became clear that what is the really, this called itself Foundation for a Smoke-Free World, but the basic agenda is to promote e-cigarettes, not really to stop cigarette smoking, but just to promote e-cigarette. And when it became very well known, they changed their name. There is no longer Foundation for a Smoke-Free World. It's Alliance for Tobacco Free. Alliance for Tobacco Free World, something. So, but it is same. The money is same. They are from the same organization, but they have a huge amount of money. And they fund it. They fund universities. They fund NGOs. They fund other organizations. And basically, their objective is that e-cigarettes are to be promoted. They should be legalized. They should be promoted. So, although, and it is happening even now, I mean, we come to know of the even friendly organization, very, the organization that should be completely opposing the medical fraternity, people in public health, medical fraternity, who support e-cigarettes. And that is not in India. In fact, that is happening world over. This particular topic has, for the first time, I mean, so many topics divide, but this particular topic has kind of divided the public health community in tobacco control. And there are many persons who have gone on to the other side and saying that e-cigarettes should be allowed. But I think we are very clear. In India, all the persons who are working in this field are very clear. Those who are saying that it should be allowed are people we see there. Again, Dr. Sonu Goel is here, Dr. Rakesh Gupta is here, and they look at and we always talk about their background. Who are these people? And turns out that those people have had nothing to do with tobacco control. They have almost had no understanding, no work in tobacco control. In fact, I remember the first meeting, I think Dr. Ravi was there. That was, I think, in 2015 or 14 in the ministry, consultation on e-cigarettes. And it was a large 30, 40 experts there from all over the country. And I was myself surprised because, when lots of experts are there is bound to be a difference of opinion, there is bound to be differences. But on this particular topic of e-cigarette, there was a unanimous opinion that e-cigarette, this is a product that is not going to solve our problem, that is only going to increase our tobacco problem. And therefore, even in the very first meeting, the expert opinion was very clear that it is not required, it should be banned in India. It took time, but after all, it did happen after some years. So it is true that the ban is there. The enforcement still requires a lot more to be done. And we also need to understand that there are powerful lobbying and rich organizations who are players in that. We have to be active, we have to be careful, and we have to be relentless, in terms of getting it enforced better and more properly. Thank you for your question, Anshika.
So you're absolutely right. In India, all the tobacco control activists are on the one side that there has to be a complete ban of e-cigarette in India. My next question is from Ravi Mehrotra, sir. What more can be done to raise awareness among the general population about the risk of e-cigarettes, especially in the younger population? Over to you, sir. Sir, please unmute yourself.
Sorry, can you repeat the question, please?
Yes, sir. What more can be done to raise the awareness among the general population about the risk of e-cigarette, especially in the younger population?
Sure. Well, as has been mentioned earlier, the focus of the industry has been the younger population. I always compare it to, you might remember the slogan for the cricket team when they were selecting India cricket. Before the ICC, only one team used to be there, the state teams, and of course the Indian team. And the focus always used to be catch them young. So that, unfortunately, is the same philosophy followed by not only the tobacco industry and its surrogate, the electronic cigarettes and various other novel nicotine delivery systems. So, as has been mentioned earlier again, it has been found that sweet sellers across schools or the nearby pawn shops or the groceries are also selling e-cigarettes. And as I was talking about the school bags, electronic cigarettes being found in school bags, that is where the focus is. And when they found out where did they buy, they found they were the little grocery store right next to the school, which used to be involved with selling them to kids. They would obviously not keep them in public view. They knew the people who they were going to sell and also make money out of that. Most of these cigarettes or e-cigarettes, as they call it, were made in China. And we obviously have no clue as what is the e-fluid. Is there any standardization? Does it have any specific percentage of nicotine content in it? Does it really meet the safety requirements? We don't know. Unlike the FSSAI for food products, here we do not require them to, even sometimes the manufacturer's name is not there. Most of the time they are not there. No contact number, no phone number, no country of origin. And obviously, if something goes wrong, you have nobody to blame. So, as far as awareness is concerned, I think the role of the government, just the way they did it for tobacco, not only smoking, but also smokeless, the various civil society organizations, including many which are are represented here in this particular webinar, postgraduate medical and dental institutes, including the one where Dr. Sonu comes from, which has also the resource center for tobacco control, dental colleges, of course, and ideally, we should have our sports as well as cinema celebrities talking against it. You might have just seen yesterday our most famous film star, Amitabh Bachchan, who used to be the government's mouthpiece as far as polio vaccine strategy was concerned. He came up yesterday that we should have a similar strategy for non-alcoholic fatty liver. Fatty liver is a serious problem and in number of patients is increasing. I really wish that he would also go on, he and similar people who are well regarded in the film and even sports arena, to talking about the harms not only of tobacco but also the newer nicotine delivery systems. In my view, that would definitely go a long way. Secondly, just like we just showed the cervical cancer awareness month, and then you had a pink breast cancer awareness month. Similarly, I think rather than a month, we should have an entire year. And I'm so happy that the World Cancer Day, the United for Unique thing is there. So I think we should be united against the unique populations and unique set of people who are using e-cigarettes. Some are addicted to it, so they cannot do without it. I mean, that is the fact of life. And generally, they are the people who are at the beginning of their sort of life in the first, say, or maybe between 10 and 20 years of age, which is the teenage group, when you are most adventurous, you are most curious, and also you are most amenable to suggestions. So that is the population which is maximally tried, and they obviously have the next 40, 50, 60 years ahead of them. So once you get them hooked to e-cigarette, they will continue using their money and unfortunately have a problem with their life and life-threatening situations if they do that. But at that age, they don't realize. So as the company, Philip Morris, I think they call it, they started this particular smoke-free foundation, which has now changed to something different. They are actually the Global Action, I think they're calling it, if I'm not mistaken. That can be a serious problem, and they obviously were found out. Everybody was talking about it. That this obviously is not smoke-free, but they want to make it electronic plus rather than smoke-free. So the Global Action to End Smoking is the name for their new avatar of the same organization. And this is only one of them. There are many organizations, including some who are very, very active on social media. I mean, many of us have been trolled to a large extent on social media that, why are we trying to curb the freedom of people? Why are we trying to kill people? Because if they don't leave cigarettes, they are going to die, and so on and so forth. So the question which is quite often asked to us at various public and social media fora is, if it is less harmful, why are we trying to go against it, or why has the country banned it? Because they did not really expect, the industry did not expect India to ban it. So the answer to that is twofold. Number one, as far as we are concerned, it is like jumping from the 5th floor of a building as compared to the 10th floor. You might die in both, you might hurt, might be very badly injured, both. So it is a lesser evil, possibly, but even the e-cigarette companies do not claim it to be a quitting tool. This is actually a myth that has come from various institutes, various researchers, and one country in particular, which had ruled India many years ago, that has been the strongest proponent. And there, for some reason, they have convinced their Royal College of Physicians also to support this. And the government is also, at one time, if I'm not mistaken, that particular country, which is a small island, which is not in the EU, were distributing free e-cigarettes to their people. Even the government was putting in money into it. So I am not sure as what is the commercial agreement between them. But that is the kind of scenario which we obviously wanted to avoid in India. We have enough problems with our smokeless tobacco, with our various hookahs and various means of consuming nicotine. This was the last thing we wanted. And the reason why we went for the ban at that moment, because we were hoping to nip it in the bud. We also knew that like no ban actually works 100%, but at least it will kill the open commercial market of e-cigarettes. And the number, they will be smuggled. We all knew that. They will be available. I mean, you can try your best. But hopefully it will be much less than what would be around when all these big tobacco companies would be exporting officially these particular devices. Thank you.
Thank you, sir.
I think there are some questions in the chat. You might like to have a look at them.
Sir. Okay, sir. So shall we take the questions first, or let's end the panel discussion?
All right. We can do that.
Yes,
That's
sir.
fine.
Thank you, sir. My next question is from Rakesh Gupta, sir. Sir, as Sonu Goel sir has told us that you've been played a catalyst role in in this initiation of e-cigarette ban. So I would like to hear from you, if you have no problem, sir. I would like to hear from you that how you convinced the stakeholder for this major step to against the e-cigarette.
Yeah, thank you, Dr. Ashika and Dr. Ravi, for organizing this workshop. This is really important. And it was way back in 2012 when I went to UCSF, and I came to know that they were actually struggling with the e-cigarette addiction, even at that time when nobody knew in India. So I thought that it should be banned in India, but we couldn't convince the Ministry of Health and Family Welfare. So we banned it in Punjab first, right? And it was easy because we had a lot of papers already which said that it is harmful, and there's nothing like harm reduction. If we use electrons, as Dr. P.C. Gupta said, that it really causes harm. And to Dr. Ravi, I may tell that it is a cancer promoter also. The nicotine is a cancer promoter. So it also causes cancers, in addition to the the addiction and the brain development disorders. So I think the state drug controller was convinced, and he issued a very simple one-line notification that it should be banned because it is not allowed under Drug and Cosmetic Act. And under Drug and Cosmetic Act, only things which were allowed were the nicotine patches, nicotine gums, and nicotine lozenges. So on that basis, we banned that in Punjab because it is disallowed under Drug and Cosmetic Act. So, and it was followed by 17 other states. So on the same premise, they banned under Drug and Cosmetic Act before Government of India banned in 2019 under PICA 2019.
Thank you, sir. Thank you, sir, for telling the story behind how you managed to get the ban in Punjab. My next question is from Sonu Goel, sir. E-cigarette has been falsely regarded as a safer alternative to traditional smoking. But experts argue that they may not be safe as advertised. What do you believe is the biggest misconception or the confusion people have about e-cigarette, and how can we address this? Over to you, sir.
Yes, I think this is the most common myth which is being propagated in the smoking and the non-smoking community, both. So the people who are smokers, so they are being told, yes, if you want to quit, this is the one, this is the wonder, this will do wonders. You just don't have to take any nicotine patch or nothing. We are giving you nicotine. But no, how we can scientifically counter this myth is that when you smoke, when somebody smokes, so in that puff, it is an unregulated amount of nicotine which goes inside. It is not regulated. It is like if you take the puff very strongly, so more nicotine will go. If it is being taken less. So again, I think this is the way. And when somebody takes the nicotine patches or lozenges, there is a fixed amount which goes. And when you take a drug, for example, if somebody is suffering from a URI or sore throat, so if you give 500 milligram of ciprofloxacin for so many number of days, the person will be cured. But what will be there if suddenly like 2 grams of ciprofloxacin is given? So there is bound to have side effects. So similar thing is happening in this. So this is one thing. The second thing is, I just quote an article from NEJM. So this is a very renowned journal with the impact factor of, I think, 96 at this stage. So that way back in 2018, that article has said that nicotine acts as a gateway drug on the brain. So nicotine acts as a gateway drug on the brain means that when somebody is taking nicotine, so any other addiction, if somebody is, that article has not named any addiction, be it cigarette, be it other thing. But if somebody takes that, so that is more propensate that particular addiction, right? So that is one thing which we need to remember. The other thing which we need to remember is, you asked about youth. Why industry is after youth? Yes, I think one of the other reasons, there are many reasons. I think youth they are known to experiment, they are known to having some lavish, these things, some stylish things. So these are some of the things. But why they do it? Because of some scientific reason as well. And what is that scientific reason? That scientific reason is that there are neural pathways within our brain. There are neural pathways within our brain. So brain used to have, like, for everything we eat something. So the brain neural pathways are a particular structure for a particular thing. So what happens? There is a sleeper effect. Sleeper effect means if somebody is not taking anything, somebody is sleeping, and suddenly, you just imagine if somebody is sleeping and suddenly he or she is being waked up with a very loud noise, a bomb, what will happen? So, and if somebody is already awake, he is also, there is a bomb. So the shock of the prior thing will be more, the person who is sleeping, right? So similarly, for adolescents, for children who has never taken any addiction, and especially the nicotine, which is even more addictive than heroin, right? So if suddenly the nicotine comes with e-cigarette, so that sleeper effect means, so immediately even few puffs of e-cigarette can make that person vulnerable to tobacco use or cigarette. So that is one of the scientific plausibility of why e-cigarette leads to the gateway effect. But yes, I think it is very complex phenomena. It is non-linear phenomena, and it is a multi-directional phenomenon. Three things. This is very, because the studies which have there are very different type of studies which says, and most of the study says it is bidirectional. Bidirectional means that e-cigarette leads to cigarette smoking and cigarette smoking leads to e-cigarette. Right? So that is, but again, I think the thing which emerges more in the scientific evidence is the prior one. E-cigarette leads to cigarette smoking. So these are some of the things which are there. And again, one of the article I'm just quoting of Dr. Simon Chapman in way back in 2018, and he also told there is a strong evidence of plausibility. There is strong evidence of plausibility and specificity of a possible causal effect of e-cigarette on smoking. And he has quoted this statement based upon a meeting of a National Academy of Science, Engineering and Medicine. So they have quoted this statement that there is a strong evidence of plausibility and specificity of possible causal effect of e-cigarette on smoking. So that says like NEGM and these articles by well-known experts of smoking. So they says that there is a definite effect. And again, we are in the process of doing umbrella review, which has been commissioned by WHO. So the findings are still not out. But yes, I think the preliminary studies, I think there are 69 systematic review which are there, and we are trying to combine them. So what are the things which have emerged out of it? That the odds of cigarette smoking by a non-smoker who had any experience of vaping more than tripled compared to no vaping. That means the person who is vaping or doing e-cigarette are 3 times more prone to take cigarettes, right? So this is most of the evidence says on this, and I think there is a abundant evidence which says. But yes, I think as Dr. Gupta, Dr. Prakash Gupta has said initially, we know much about e-cigarettes because there has been a lot of evidence. It has been there since 1960s or even before that. But e-cigarette has just come 2 decades back, and there is a growing level of evidence, and we don't know what is the long-term effects. Still, they are coming. The long-term effects are still coming. So I think we should not wait for them to come and wait for the same situation as Dr. Rakesh has told that in US it has come to around 27% to like the prevalence has gone like that. In India, still we have around in the last survey we have around in points. So we don't want that epidemic of vaping to come before we stop it. So I think the implementation of the existing laws, the ministry has done wonderful job of banning it, nipping it in the bud. Now it is, I think, us, the implementers, the NGOs, the academia, to take cues from there and help Ministry of Health and Family Welfare in further progression of so that we don't progress further on the e-cigarettes. Over to you, Ansh.
Thank you, sir. Question well answered. My next question is from PC Gupta, sir. Sir, talking about the harm reduction strategies, do we have any evidence that e-cigarette have a role in tobacco cessation or any involvement in actual harm reduction?
There are like case reports are there that people have said that okay, they have reduced their cigarette smoking or they have been able to leave cigarette smoking and started using when they started using e-cigarette. But I think we have to remember that both are nicotine addiction. So what one is doing is substituting one addiction with another addiction. And newer reports are clearly suggesting that the addiction to e-cigarette, nicotine addiction among e-cigarette is as powerful as nicotine addiction among a normal cigarette. So in terms of harm reduction, there is really not that we can agree, I mean, in India, we don't agree at all with this philosophy of harm reduction using e-cigarette because as Dr. Mehrotra had said right in the beginning, it's like comparing, dropping down from 10th floor to second floor or first floor. The harm is still there. So it is, and we know we have enough strategy, and all over the world we are showing that we can do the harm elimination completely as far as tobacco is concerned. The strategies that are there that have been codified also in FCTC being followed by many countries have further advanced, and yeah, countries are reducing their tobacco use considerably. Even in India, there are now signs that we are reducing tobacco use. So I think we are all working and going towards harm elimination, not harm reduction, which is really I think it's a kind of mirage that if those who are going towards it will soon see that it is no longer a harm reduction. It is an addition of harm of some other kinds. We already know that the prevalence of use is very high among youth in those countries that have allowed e-cigarette. Canada and US and many other countries, the prevalence has gone very, very high. And this is among youth who would not have used e-cigarettes at all, if they were not promoted, and would not have used combustible cigarette also, because their prevalence anyway is going down quite drastically. So it's not harm for an individual smoker. It is perhaps could be, but for general population, it is certainly not a harm reduction, and it is not targeted towards smokers for simple reason by the industry that it will not be profitable if only smokers, if they market it to smokers. Second point is, as has already been said, it has not been approved by any drug controller, drug authority in any country as a cessation device. So the claim that it will help in stopping tobacco use is wrong. And it is surprising, in fact, for some people who may not be fully aware of the topic, is that why it is not being approved by drug controlling device agencies as a possible cessation device. And the simple reason is that tobacco industry has not applied for it. They have not applied to any drug controller in any country to declare them as a cessation device, for the simple reason that when a drug controller looks at a drug, the most important aspect is the safety aspect. Efficacy comes second, isn't it? So these e-cigarettes will never pass the safety aspect. So there is no question of efficacy there. So this particular line of thinking and line of argument that industry is pressing of harm reduction, that is basically to confound people and policymakers, and to keep on increasing their profit. And there is no further really advantage or should be any talk of harm reduction, at least in India, because in India it is going to definitely increase the harm rather than doing any harm reduction. So thank you very much for your question, Ashika.
Thank you, sir. My last question is from Sonu Goel, sir. Sir, despite the ban on e-cigarette, they continue to be marketed through various illegal channels, often targeting youth with appealing flavors and sleek designs. How can we neutralize such social media and online platforms which continue promoting the e-cigarettes?
Yes, I think that's another important point to add to my previous speakers. So I think there can be few strategies which we can think on. We can leverage first of all on the ban, the law which has been there, ordinance which has been there, and now Government of India has started a complaint system. So there is if you Google, so there is a link where you can complain where these e-cigarettes are being sold, and that complaint will be is likely to be addressed. This is number one. Number two is like on the social media. I think we need to make them aware about certain things. It's not only about this particular act, but it's a harmful product. And I still remember in Punjab, so there was the act which was applied on one of the persons selling e-cigarettes at a shop was JJ Act, Juvenile Justice Act. Now, what is Juvenile Justice Act? If somebody is found selling any harmful product to any person, so that person can be imprisoned for 7 years. So 7 years if somebody is found selling e-cigarette to a juvenile or to a person who is the child, we can. So that person can be jailed, and there has been instances in Punjab where the people have been jailed for 7 years, and also fine of 1 lakh rupees. So just selling a cigarette, who will, if every state will have one or two such punishments. So who will sell a product for which that person is jailed for 7 years and fined for 1 lakh rupees and subsequent fine for 2 lakh rupees, right? So that is a huge deterrent. So that is the thing. These are the punishments which we need to propagate. And I think the third thing which we need to do for effective implementation is working with the government, state government. We have the national government ban. So you don't have to create any new circular in your state. So just I think the rates in these sites where these things are there, and you can get from informal channels which are there. And I think we should not go we should not. I believe that there are multiple ads, especially on the social media side, which are being liked by these youngsters, but we should not counter those ads. I feel that instead of countering, we should actually preemptively create some of the ads which are logical and which are based upon science, logic, as well as emotion. I think both the things need to be catered, brain and the heart. So I think when we create such sort of ad which appeal not only to their heart but also logical, we should be able to do that. And for that, we should have some good communication medias and all those things, influencers. And like Dr. Prakash Gupta has said about Amitabh Bachchan. So similar type of influencer, when we did in one of the initiatives, social media initiative in Punjab, not for tobacco, but for trans fats. So we did a project on trans fats for 2 years. So we involved all those people who are in sports in Punjab. Even we involved Milkha Singh ji. So Milkha Singh ji spoke for trans fats, why we should eliminate, we should not eat these type of food. So we should find out those influencers, which may not be a very big celebrity, because reaching a celebrity sometimes is very difficult. But celebrity in terms of people following that person, I think we should be able to find out. We found out few film stars, because in Punjab we have lot many people who sings. So we caught hold of those singers, caught hold of those sportsmen, some gym trainers. So all these people can be your mouthpiece. So I think this is how we need to promote. Rather than individually yourself doing it, myself doing it, who doesn't have much followers. But I think we should involve those people who have the followers, and that creates a team. I think in the teamwork, we can do that influence. Yes, Anshika, back to you.
Yeah, thank you, sir. I have one more question from Mehrotra, sir. Sir, there have been a report about novel nicotine delivery products such as nicotine pouches, which although is not in Indian market, but surely might capture our population in coming years. How can this this blanket ban of e-cigarette be applicable to such more products which will be coming to our country in India in future?
Thank you. That's a very relevant question. As far as the ordinance that was released, basically against the law that was released by the government, they actually talked about prohibition against the production, manufacture, import, export, transport, sale, distribution, storage, and advertisement of electronic cigarettes. Right. So they did not explicitly mention each and every newer nicotine product. That is true, because that was at that moment the main issue that we wanted to fight. But yes, you are absolutely correct. There are many non-combustible cigarettes, not cigarettes, but tobacco products or the nicotine products that are available outside, whether pouches, and all sorts of other newer products are coming in. Obviously, we have to be careful about them. The good news is that they are relatively expensive for their general use as far as India is concerned. They're just cheaper to get smokeless tobacco. I'm not obviously in any way trying to be an advocate for smokeless tobacco, but nicotine, first of all, how pure it is. There may be impurities. I believe there are more than 5 to 7,000 other chemicals in addition to nicotine. Nicotine per se may not be carcinogenic, but it definitely, what we are told from research, that it affects and it can enhance the carcinogenic effect of various other substances. So ideally, any substance, and in addition to that, with other cardiovascular and other body effects, may not be cancer, but there are other issues that come through. So as far as we are concerned, as Dr. Gupta also mentioned, we have enough problems with smokeless tobacco, which constitutes nearly 70 to 80% of our tobacco consumption and nicotine consumption, direct or indirect. India is not in a position to take any more products which are novel that will further increase our problems. The other issue which I wanted to point out, I'm sure speakers might have mentioned, that even in the United States, the prevalence of electronic cigarettes is going down as people are becoming aware of the side effects. It was very well known, there was a big court case in which the Juul company were paying young, fashionable influencers on the social media to peddle their product. And they were targeting youngsters, obviously, even teens, early teens or pre-teens, and giving them information about flavored e-cigarette, whether it is pineapple or it is cherry or it is apple, all sorts of things were there to make the taste even better. So, and also they were E-Valley, which is a lung disorder. We had children admitted to, especially in Los Angeles, to the hospital in ICU, and some may have suffered irreversible lung disease. And all those information, plus the Juul company, the shares fell by, I think, about 80 to 90%. You don't see Juul anymore. And since I spent some time in the United States as well, every corner there was an e-cigarette shop and e-fluid shop. They have actually become much less. So as they say, quite often we tend to follow the trend much later. And for example, in the US, the tobacco consumption now, smoking is down to 12%. We are still, although we are better from, say, 10 or 15 years ago, we are still at about 26+%. So as the prevalence of tobacco use will go down, both smoking and smokeless, people will explore other avenues. And it is, I think it's a great idea to have a watchdog in the social media as well as in the non-governmental and governmental organizations, that new products don't get a foothold in our country. And people are hopefully going to a nicotine-free world, if I may use and paraphrase the smoke-free world. We want a nicotine-free world, with whatever form it is possible. Because I don't think I need to go into all the dangers of nicotine and the dangers of tobacco and dangers of tar and so on and so forth. That will probably be covered in the future webinars and teaching sessions in this course. Thank you so much.
Anshika, can I intervene?
Before I finish. So, Dr. Gupta,
I'm sorry, sir. Sorry.
No problem. Another issue that has come up is the people who are hooked to e-cigarettes, now they are asking for cessation. How you were talking about stopping smoking by using e-cigarettes on one hand, other side, now we are asking that there are courses available and there are various counseling sessions to, and even telephone apps are there, smartphone apps to help you to stop e-cigarettes. So this is a very interesting thing. Now you're wanting cessation aids for e-cigarettes. Now what are you going to get next? So there is a never-ending cycle. Sorry, I interrupted you, Dr. Gupta. Please go ahead.
It's okay, sir. So, Ashika, I just want to add about the oral nicotine pouches. Actually, intern of ours, she did a study on oral nicotine pouches availability online, and we searched about 91 online sites, and all were selling or promoting oral nicotine pouches. So it is not that oral nicotine pouches are not available in India. Moreover, Drug and Cosmetic Act can be applied for the oral nicotine pouches, as we did in electronic cigarette, because nothing in addition to nicotine gums and nicotine lozenges and nicotine patches, they are allowed under Drug and Cosmetic Act. So we can apply that act to this nicotine pouches also. Yeah.
I would agree, no
Actually, I
doubt.
wanted to say the same thing, what Dr. Rakesh Gupta already said,
Oh, thank you.
that nicotine pouches are already there in India, they are
Yeah, yeah.
available, and we have to be very careful because in USA, the nicotine use of nicotine pouches among adolescents is already now getting recognized as a serious problem. There is a lot
Right.
of nicotine use among adolescents in the USA and perhaps in other countries also. And
Correct. So we
I
keep
would
on.
fully endorse what Dr. Ravi Mehrotra has said. Ki let us not simply talk or think in terms of tobacco-free world or tobacco-free India, but we need to advance further, keeping the industry tactics and marketing into mind to nicotine-free India and nicotine-free world. And we have to have strategies for nicotine elimination rather than simply harm reduction. Thank you very much, Anshika. Sorry for interrupting in between, but I thought I would say a couple
No,
of
sir,
things. Thank
that's
you.
not at
No, sir.
all an interruption. This panel discussion is framed for you all so that your knowledge can be transferred to our participants. Yes, e-cigarette is the, like, we have started the course for the first time. So it is the plan of Dr. PC Gupta sir who has initiated that. Let's take this session as a panel discussion instead of giving a presentation. So thank you, sir, for your suggestion. Your suggestion well taken up. The floor is now open for the participants to ask questions. Uh, or there are many questions in the chat box. So I would like to start asking the questions from the chat box. Rakesh Gupta sir has also helped us in answering few of the questions. Thank you so much, sir. Uh, Dr. Aruna has asked a question. Ma'am, would you like to ask a question in person or should I read it from here if answer is not if not answered?
Yeah, actually, it was answered by in the chat box itself. So you can
Okay.
ask it in this video. What's written?
Yes. So any other question which has not been answered by the participant, please raise your hand and I will start taking it one by one. The floor is all yours.
Actually, my query was like in a state like Punjab, wherein the substance use problem, the opioid and the cannabis had superseded the nicotine. So in a such state itself, they took an initiative. So was it because of the electronic nicotine device as a device, e-cigarette as a device, which could be customized for nicotine as well as cannabis and other substances? And is it like since it was targeted on the youth, as is it just to ban the gateway hypothesis? Right?
Dr. Aruna, I think the tank devices can be used for putting other
Yeah,
addicting
customized
substances
things,
also.
the THC
Yeah,
and
yeah.
all. No?
Yeah, it is
THC,
already, as I think Dr. Ravi, he told about the E-Valley. So E-Valley was partly because of that also,
yeah,
because
THC.
other products were put into it. And it is definitely, nicotine is a gateway drug. So it should be banned actually. Thank you.
The next question is from Dr. Himanshu Pandey. He has asked flavors of more than 10 types are additional attraction to children and they make it a style statement along with among their peers.
Actually, there are now more than 7,000 flavors. It's not limited to 10 flavors. So some say even 15,000 flavors. But surely there are many more flavors available now. And it is a style statement, surely.
And also, it is interesting that it is teaching young children already sort of things like crowdfunding and sharing of resources. That is, they buy e-cigarette, one buys e-cigarette, and then one by one everybody uses it, or they pool their pocket money together and buy e-cigarette. So there are so many strategies that are being sort of suggested to children, and they have started using those strategies for buying and using e-cigarettes.
Sir, I can see that in chat box, most of the questions has been answered by Sonu Goel sir and Rakesh Gupta sir. Thank you so much, sir.
So,
Uh,
Dr. Anshika, I just want to add that the Director Revenue Intelligence that is doing a very commendable job I mean, tackling the menace of electronic cigarette. So I think we must use other stakeholders, stakeholder ministries like like Ministry of Electronics and Information Technology. So they are doing a commendable job for acting against electronic cigarettes. So Professor Sonu Goel, actually, we and all the state must involve academic institutes like we have involved in Dr. Sonu Goel with us for tackling such issues.
Sure, sir. We have a question. We have Dr. Ashim Bhandari from Nepal. Dr. Ashim, do you have any question?
He might have dropped off.
Uh,
Yeah, apparently there are electronic cigarettes going around in Nepal as well. I'm not sure how serious the problem is, but it will be good to, maybe in one of your future sessions, you might like to have somebody from Nepal as a faculty, and all other our neighboring countries. But I believe Pakistan and Bangladesh also have a serious problem. So all over South Asia.
Sure, sir. We will try to do that in our coming sessions. Sir, one of my question is from you that you've been like traveling overseas and been in US since a few years. So what is the trend of e-cigarette in US, and if we see whether e-cigarette in US and in India, what is the trend, the
So
difference?
I alluded to, I mean, there are obviously e-cigarettes are freely available. There are shops which are advertising the availability along with cigars and uh, water pipes and all sorts of other nicotine products. So this is one of them. And e-cigarettes are prominently advertised, although even in the last 3 to 5 years, they have reduced dramatically. Earlier, you used to see them in every corner. Now you see them in one or two places at a few miles apart. So the trend is actually on the way down. As was mentioned earlier, nicotine pouches have actually gone up, and various other newer things are going up. There are another development which has been in cigarettes in the US and I think many other Western countries is that the menthol flavor has been, much less. Some of the countries have banned it because that would create a very sweet, nice, smooth taste. So there are, and the other very interesting proposal that had come from FDA a few years ago is to gradually reduce the nicotine content and to make it less addictive. Although with the change of government in the US, I'm not very sure how things are going to go. So there was a movement from New Zealand that they will actually stop sales of any tobacco product, especially cigarettes over a certain age, a year when they were born. But that has been retracted. Similarly, there was another proposal from Great Britain that they're going to do that. Now it is yet to be seen how, with changes of government, are they actually going to stick to those proposals or not. But as all these screws get tightened on tobacco, I think you are going to see more and more newer delivery systems for nicotine come up. And I think it is up to us in civil society as well as researchers and activists in this areas and academics to at least make the people aware so they can make their own choices. For a country like India, it is not going to be very easy because no ban actually works anywhere in the world, and this also is not going to be. I mean, you very well know in every corner, especially in tier 1 and tier 2 cities, nearly you will find one or two shops in every major market where things are available. We know that very well. But obviously, they are not being sold openly, and that is a big relief However, surreptitiously online and various other methods that people, when they, as I say, where there is a will, there is a way. Unfortunately, there is a will in many of our youngsters. Thank you.
Thank you, sir. We have another questions. Sonu Goel, sir, can you please tell us what about the harmful effects of menthol? Dr. Aruna from ICS wants to know what about the harmful effects of menthol?
Yes, I think these are some newer things which are emerging every day. And although, as such, menthol doesn't have any carcinogenic or any sort of effect, but menthol actually potentiate because there are three things basically. If you feel there is a attractiveness, addictiveness, and toxicity in a product, there are three things: attractiveness, addictiveness, and toxicity. So either if a product does either of them, that basically is being categorized that that product should not be used. So definitely, I think it's not toxic as per the literature says, but yes, it is it more is suitable for attractiveness. So because when people have taken the studies are there, and when people have taken menthol along with the other products, so that people will like to take more because of the cooling effect or because of the other sort of things which are there in menthol. And there are also studies which potentiate, because it also changes the pH within the a microbial, the flora which is in our mouth, and also it leads to the increased absorption. So some studies have also said that, but yes, there is still, there are a lot of evidence which are coming, and people have banned menthol. There are various countries which have even banned menthol. Uh, and I think Dr. Prakash Gupta can add to that.
Yeah, thank you very much, Sonu. I think that was a very comprehensive kind of answer. But just add one point, which we often overlook. That tobacco is the most disagreeable substance for using for anybody. In the smokeless form as well as the smoking form. It is harsh. It will affect your throat. It will affect your sense of smell, your mouth, everything. So, as a newcomer, nobody would like to smoke. If you give a smoke to somebody, ask them to smoke, they will start coughing and will not like it. So, what menthol does it, as Dr. Goel has said, it cools down, it anesthetizes, and it reduces considerably the immediate harmful effect or aversion to tobacco smoke. And that is why it helps a lot in initiating and sustaining addiction of smokers. In fact, it has been well recognized that among black population in the USA, their smoking rates are high, very high, and that is because of menthol. A large proportion of them use menthol cigarette, and that is why the demand has been there to ban menthol, but that has not been easy. They banned all other flavors, but menthol was permitted. So with menthol, not it is so much because of the any carcinogenicity of menthol itself, but what it is doing to increase the addiction and carcinogenicity of tobacco product and tobacco smoke. Thank you, Anshika.
Thank you, sir. As we are coming, no further questions in the chat box. I think all questions answered by our expert. And with this, we have come to the end of our session. Any of the expert would like to add something to the question, to the answers, or to the questions of any participant?
Yeah, Anshika, I would like to add something about
Yes, sir.
menthol, because in India also menthol cigarettes are available. So the first country to ban it was Brazil way back in 2012, and that was followed by countries like the UK and Canada. The FDA also wanted to do this 2018, but the proposal was put on hold because there was a lot of public backlash. And as Dr. Gupta mentioned, especially the colored population was very used to menthol cigarettes. So the US, although it is at the forefront in many things, but it has not been very effective as far as pushing through these new regulations. So the reason why it gives a cool and a sort of sweetish taste in the mouth, so it becomes more easily accepted by the youngsters. So that is something we have to be very careful about, at least in our part of the world in South Asia as well. So in principle, I would like to just thank all the participants here. We had close to 60 or plus people on a Friday afternoon. It is no mean feat. And this also is a curtain raiser for your course, which I think lasts over the next 6 weeks or so. So we would like all the participants not only to attend, and I know there are a lot of questions which may be coming up in the future sessions as well. And also request your colleagues, students, and peers to be part of this particular program. And I'm also thankful to all our experts, the present ones and the ones who are going to be taking part in this. And of course, our partners, the education partners of ECHO India. Thank you so much.
Thank you, experts, for enlightening us. We have covered the background, the journey, the health risk, how the ban started, why tobacco industries are focusing youth, and what are the safer alternatives by tobacco industries, why they have made it, asked it as a safer alternative, social media advertisement, etc., etc. So with this, we have come to the end of our today's session. I would now request Mehrotra sir to please give us a closing remark.
I think I've said whatever I had to say. I think we are running out of time.
Yes,
Thank
sir.
you
Yes, sir.
all, and let us reconvene next week. Is it? When is
Yes,
the next
sir.
session?
Yes, sir. Next session. I'll just
Sure. You can send out a message to. I'm getting a lot of personal comments here on my chat box, sort of thanking the group, and we are missing Shekhar today. He's not too well, but he is
Yes,
part
sir.
of the group, so he sends his. We send him good wishes to get well soon,
Yes,
as soon
sir.
as possible.
So he
And
was very eager to join this.
I
He is
know
continuously telling us what to do, how to do, ask this question, this has to be done, and he's not able
that
to
is
speak due to some throat infection and sort of thing.
perfectly fine. I think
You missed Dr. Shekhar.
so, and also it is a good idea to just sit and watch sometimes what is
Yes, sir.
happening. And thank you, Kunal and Anshika, for taking over. And we will hope we'll be getting all the participants, and we hope to get some new people also joining the organization shortly. Thank you so much for your help.
Thank you.
Thank you, everyone. At the end of the session, I would like to thank ECHO team, especially Dr. Sanchika, who is she here?
Yes, yes.
Yes. Thank you, Dr. Sanchika, for being with us throughout the whole session. Thank you very much. We missed Dr. Haresh also. Due to some reason, he is not able to join us, but definitely we are expecting him on our coming sessions, our inaugural sessions. Thank you, everyone. With this, I'm just concluding the meeting. Thank you, everyone. Thank you, PC Gupta, sir. Thank you, Sonu Goel, sir. Rakesh
Just a
Gupta, sir.
reminder,
Thank
ma'am.
you. Thank you,
Just
everyone. Uh,
just a
okay.
moment.
Okay.
To message for all the participants. This regarding this course, obviously, upcoming sessions will be conducted on every Wednesday, 3 to 4 p.m. This was the inaugural session, that's why we kept on Friday, but the upcoming sessions will be conducted on every Wednesday, 3 to 4 p.m. You all will receive a mail regarding a reminder email 30 minutes prior the session. That was the information. Thank you.
Thank you, Kunal, for the information. We'll see you on Tuesday. Thank you, everyone.
Wednesday.
Wednesday, yes. Wednesday, I'll be making these sessions on iEcho platform. Thank you, everyone. I'm ending the session now. Thank you, sir.